Welcome back to Nutrition Science Bites. And today I'm talking to Dr. Alan Barclay. Welcome back, Alan.
Thank you very much, Professor Claire. Really appreciate it.
Yeah, Dr. Alan Barclay, nutrition scientist, blogger, presenter, and accredited practicing dietitian. I saw you recently post an article about diabetes reversal. And I thought, wow, this is something that people who've been diagnosed with diabetes really want to know about. So I'm just going to ask you up front, is it possible to reverse diabetes once you've been diagnosed?
It's possible to reverse type 2 diabetes, Claire, and I guess we need to be specific about that. For type 1, lots of work underway in that space, but not there yet. But with type 2, we definitely have very good evidence from randomized controlled trials that you can reverse it or put it into remission.
So, Alan, I think it's helpful for people to understand what the difference is then between type 1 and type 2 diabetes. Because if someone has type 1 and a well meaning person says, no, no, you definitely can reverse diabetes, you mustn't be trying hard enough. Can
Yeah.
you explain why that's not actually possible at this stage? The difference then between type 1 and type 2 diabetes?
Most definitely a very important point. So type 1 diabetes is thought to be an autoimmune disease where the body's immune system, for some reason or another, attacks the insulin-producing cells in the pancreas. It generally happens in childhood, so around about 5 or 6 years of age or 10 to 12 years of age at the peak, but it can happen in adulthood, and that's where it gets a little bit confusing. People that have type 1 are basically dependent on insulin for the rest of their lives at this point in time, and that can be delivered through injection or much more commonly now pumps. And, we've got a hell of a lot better at managing that condition, but we can't cure it yet, though, as I mentioned, that there is an awful lot of research going on at the moment, and maybe we will one day, but not at this point in time. Whereas type 2 is a metabolic condition, and that generally starts to happen. Look, typically it happens around about 45 years of age and later. If you look at the prevalence data that we have through the National Diabetes Services Scheme here in Australia, that's where it really picks up. But you are starting to see a few, unfortunately, I'd say adolescents, not children, teenagers, that are developing type 2 diabetes too. They do tend to be from specific ethnic backgrounds, so there's a very strong genetic component there. For the majority of us, we're middle-aged. We've started to put on, well, I think clinically, from my experience, we tend to get married around 25, 30, start to have a more sedentary life, still eat and drink what we used to when we were young, and we start putting on about half, maybe 1 kilo a year in weight. And by the time we're mid-40s, that's amounted to maybe 10, 20 kilos, and that's when the type 2 diabetes kicks in, because, and I really must point out, it's excess body fat, not weight per se. And we like to talk in terms of weight all the time, but of course, muscle is a good thing. It's body fat that's not a good thing, and particularly if it's around our organs, our pancreas and our liver, that's what's driving the type 2 diabetes. So abdominal fat.
So, so Alan, you're saying that, as you gain weight, as you age, that actually where the fat gets deposited, that's what's interfering with your metabolism. And so your body is still producing insulin, but it actually just can't work the way it should to clear the blood glucose. So now
Yeah.
you have what's a metabolic condition, type 2 diabetes. Have I got that right?
Oh, spot on. Yes, spot on. So
Okay.
the extra fat around the pancreas seems to reduce the pancreas's ability to produce the insulin, and also extra fat, and it starts to appear in muscles and the liver, of course, fatty liver, and that affects insulin sensitivity. So we get what's called insulin resistance, and the combination of the two produce the type 2 diabetes.
Yeah, I think the way I tend to picture that in my mind is, like if you're in your house and everyone's got one of those cupboards where you just jam stuff in there. And so that's kind of the same thing that's happening when you're storing extra fat in your pancreas or in your muscles. The cupboard is so jammed full that if there's something in there you really want to find that's valuable, like insulin in your pancreas or insulin getting the glucose in the muscles, all the other stuff's in the way. So I think that helps people visualize why it can be a disease that's associated as your body weight is going up. But really, as you've explained well, it's really as your body fat is going up and it's getting in the way.
Yeah, nice analogy. I like that one.
Yeah, and I think it's really, really important because I'm sure, like as a dietitian who specializes in diabetes, you probably hear people confuse type 1 and type 2 diabetes. And I think that's really confusing for people if the general public, if everyone doesn't understand type 1 diabetes, autoimmune condition, where, is it things like a virus that's just hammered your pancreas and so you can't produce as much insulin? Or what actually causes your pancreas to just not make enough insulin in type 1 diabetes?
Lots of theories, Claire, and one of them is viral, but there's been others over the years. We looked at potential of cow milk protein in a randomized controlled trial where that didn't show the results that the hypothesis suggested. So there's lots of ongoing research, and even some Australian research is showing that the causes of type 1 diabetes are changing even in Australia over the decades. So I
Oh,
think, we like to lump everything together because it's easy, but I suspect there are many different triggers in different people, and partly that is genetic, of course, and not much we can do about that at this point in time, but we might be able to in the future. So.
right. Okay. So you're more likely to have other family members when it's type 1 diabetes, big genetic component and a big immune component. So let's now jump back to type 2 diabetes. So we've heard about reversal. Does that really mean you do something special and wake up and your type 2 diabetes is absolutely gone?
If only it was as simple as that. But most things worth doing in life aren't simple. It does take considerable effort, and the studies that have been done to date, and there's been many of them, um, published in the last just over 7 years now.
Wow.
I mean, I recall back in my early career working back at Royal Prince Alfred Hospital in Sydney, we were actually putting people into type 2 diabetes remission back then. So, but it's only just
Right.
been studied in randomized controlled trials and published. So I think it's important that we talk about those. And the basic principles haven't changed. Again, back in the 90s, we were using what's known as very low energy diets or very low calorie diets, which are not easy. It requires drinking essentially a special kind of milkshake, and they are regulated under Australian food law. So they're nutritionally complete and they're relatively high in good quality protein. You take these 3 times a day for, generally speaking, about 3, but up to 6 months, depending on the person. And that's because you need to lose about 10% of your starting body weight, which for an average Australian is about 8 kilograms. But the more you lose, the better. So if you lose 15% or 12 kilograms, chances of going to remission are about 9 out of 10, whereas at the
Wow.
if it's 10%, then it's around about a 50% odds, or 1 in 2. So the more weight you lose, the better. And studies around the world have shown this, including ones conducted in Australia. There's this dose-response effect. So I guess if you want to keep going, and you can, and I warn, even if you love milkshakes, by the end of 3 months, you generally are a bit sick of them.
Yeah.
It does work. So that's the challenge.
Alan, can I just jump in there? Because don't you find it interesting that when you just talk about it in terms of numbers, it sounds, oh, right, just, drop 10% or go for 12% of your body weight, just drink milkshakes. It makes it sound easy. And you and I both know that that's actually not as easy as what it sounds. So I'm going to get you to take us through what that actual process of following the milkshake diet. And I think they're kind of a product that's now just in the environment. Like, and I always find it interesting. You go to the giant chemists and you walk down the aisle, and one side are these formulated meal replacement milkshake diets, and the other side is all the bodybuilding powders. It's just go, well,
That's
this
right.
is this is so interesting. But can you take us through? So can we try and turn some of those numbers, because I think it is important for people to realize that yes, the numbers sound easy. Oh, yeah, just go away and drop 10% of body weight. But it's actually really, really hard, not without risk. So if someone is going to use one of these formulated meal replacements designed to replace essentially all of their food, what do they actually have to do? And apart from get support from their doctor and dietitian.
Yeah, absolutely. So first and foremost, all of the evidence, all of the randomized controlled trials indicate it's people who are relatively newly diagnosed with type 2 diabetes.
Right.
So in all the trials, they've had it for less than 6 years. So, and that indicates, of course, that their pancreas is, well, still has some beta cells left and is still producing insulin. So that's very important. So relatively newly diagnosed. And then, yes, if the person's taking blood glucose lowering medication, then of course they need to discuss that with their health care team, because just suddenly changing your diet, and these diets are quite restrictive, as I think you've alluded to. So, for example, if you follow your average very low energy diet strictly, it contains usually between 50 to 60 grams of carbohydrate a day, which is a lot less than what the average Australian consumes, around about 200, 220 grams of carbohydrate a day. So if they're taking certain medications, it could increase their risk of hypoglycemia. So that's very important that they discuss that with their healthcare team and get that sorted out. And obviously, not everybody that has type 2 diabetes can put it into remission, as I've alluded to in the statistics. So it's generally those people that carry too much weight around the tummy, and that is very characteristic. Most of us dietitians today have bioimpedance analysis scales as part of their practice, so we can look at that through our body composition analysis. But if you're in a clinic that doesn't have that, then running the tape measure around the waist, I generally use the belly button because it's easy to find and doesn't move. And if the ratio between your waist circumference and your height, and it doesn't matter if it's in centimeters or inches, is greater than 0.55, then you're somebody that carries extra abdominal fat. So,
Hang on, Alan. I'm just going
yep,
to jump in there because you said a lot of really valuable information. So, first of all, you said that less than 6 years since you were first diagnosed with type 2 diabetes has the best chance of achieving this remission. And then you said, and especially if that extra body weight, body fat cells are stored around your waist. And there's two ways of measuring that: fancy scales called impedance scales that tell you a percentage body fat, and tell you, the really fancy ones actually tell you where on your body it's stored,
yep,
don't they?
that's right.
But that might be harder to get those scales. But good old fashioned waist circumference.
Yeah.
But you said the weight ratio of your waist to your hips, did you
No,
say?
to your height.
To your
So
height. Okay.
the best indicator is, because the crude waist circumference, if you're a short person versus a very tall person, those just the waist circumference and the cutoffs that we use for that are for population averages. But for individuals, much more useful is the waist to height, because of course that
Okay.
takes that into account. And that's easy to do. In any clinic, you can get that
And the
measured.
good news, Alan, is that everybody's got a calculator on their phone. So you just
Exactly.
got to
Yeah.
measure
Yep.
your waist, write it down, measure
Yep.
your height, and divide your waist by your height. And if it says less than 0.55, then
Yep.
you're going to be a candidate for,
No, other way
no, the
around.
other way around. If it's
Yep.
more than 0.55, then you're going to be a candidate for trying
Yep.
diabetes reversal. Okay,
That's right.
so we've got some basic indicators for people. Then when they've checked with their doctor about whether they're going to need medication changes up front. Okay, what happens next?
So if a person's in a right space, I will say, to try a very low energy diet, and not
Yeah,
everybody is, right? And I'm sure you
yeah.
appreciate that. If you've got a family or young children, if you're the prime chef in the house, then it might be difficult for you. But if your living circumstances, and I often say the time of the year because it's better in warmer months, if they're all right, then you go out and buy, as you said, you can only get very low energy diets from pharmacies in Australia. So you will see similar looking things in certain aisles of the supermarkets, but they're not legally very low energy diets. So they don't meet the food standards requirements, which is a certain amount and quality of protein and vitamins and minerals to keep you going for prolonged periods of time. So that's the really important thing. So go to your chemist, get a good quality one, and get enough at least for a week ideally.
Yep.
because that's important as well. Because you can get various size boxes, but you're going to need to have this ideally for 3 meals a day. And I think that's where people often don't. If you don't do it 3 times a day, you don't go into ketosis, and then you may feel excessively hungry, because the biggest fear that most people have, and it's rightfully so, is that if I just have 3 milkshakes a day, I'm going to be starving. But if you have them as
Yep.
directed, then you will go into ketosis and you actually won't feel that ravenous hunger that most people expect. So that's the biggest fear when you look at the surveys. But if you do it as directed, you won't actually experience that.
Yeah, Alan, now I've got more questions, trying to think what are people going to want to know? Because, and I'm glad you tapped into that, the fear of being hungry, picking the right time where it's going to work in your life. Seems to me like if all the family or the household members are going away, you've got
Yes,
time to
that's
only
right.
think about yourself. That would
Yep.
be ideal, wouldn't it? But I mean, that's not
Yep.
realistic for most
Not for a lot
people.
of people. No.
Yeah. So, and I think that's another really good practical suggestion you said is if people want to know, can they do it? You suggest allow yourself up to like a week to test out. You need 3 of these a day at as a minimum based on your needs. And then you said you start drinking those, you follow the instructions, you buy a good quality product so it's got the vitamins, the minerals, and enough good quality protein. And then you said you go into ketosis and that stops your appetite. So what is ketosis and how will someone know when they've crossed into ketosis?
Yep. So ketosis is when your body, in particular your brain and other organs that prefer glucose, switch over to using a fat derivative called ketone. So it's a metabolite of the breakdown of fat. And the brain can switch into using that, but it takes about 3 days. And those first 3 days are quite difficult for a lot of people. You'll get headaches, you'll feel very lethargic and what have you. But it's important that you go through that. And after that, the body usually switches over and you're okay. But it's important to get there. And part of a good quality, very low energy diet regimen is that it doesn't have much available carbohydrates. So that aids that process. So basically, you're burning up your body fat stores, which is exactly what you want to do, not any other energy source, particularly your muscles, which is where the high quality protein comes in. So does
Okay,
that
so
explain it enough,
yes,
Claire?
thank you. Thank you. But just in case people are walking along and they go, oh, the dog barked and I didn't hear that, I'm just going to reinforce that. So you said at the start that really you're aiming that once you're following the formulated meal replacement or the very low energy diet, that you're only having about 60 grams of carbohydrate per day. So would that be another guide on the selection of the products? It's if there's 3, obviously it's got to be less than 20. And then I thought it's probably helpful for people to realize that, a slice of bread might contain around 15. If it's toast bread, it might contain around 20 grams of carbohydrate. So this really is a low amount of total carbohydrate, which means your body's going to run out of its preferred fuel, start burning the fat stores, and produce these ketones.
Yeah, that sums it up very nicely. And yes, there's a minimum carbohydrate requirement in the food standards as well for these special products. And you also have to have, and I should have said this, it's not that you just have the shakes alone. And unfortunately, my clinical experience is that most people would just end up doing that, but you're supposed to have non-starchy vegetables along with it. And of course, people think, well, what are they? It's easier sometimes to talk about what are the starchy veggies and it's everything else. So starchy vegetables are your potatoes and peas and corns, sweet potato, pumpkins, etc. So it's not those veggies, they're starch containing. It's everything else. It's your salads, it's your stir fry veggies, etc. So you need to have those ideally 2 to 4 cups a day. That helps keep you regular. And you need to put a little bit of quality oil in it, something that's a source of essential fatty acids. So canola oil is one of the rarer ones that you need to cook it in, and that also helps keep your gallbladder going because that's one of the side effects of these products as well. So it's not just about having shakes, and this is where it is really important that people do see a dietitian or somebody else that has expertise and experience in these, because you can get them straight from the chemist and go off and have them 3 times a day, but that's not ideal. All of the studies have actually had dietitians. In fact, mostly they were running these diabetes prevention or remission programs as such. So they were providing quite detailed advice to make sure that it was the shakes plus the veggies, non-starchy veggies that is, and a good healthy oil. And that will keep you going.
Yeah, and Alan, I think that's really important to reinforce that, because I think that's one of my frustrations as a dietitian as well. And like yourself, we translate the nutrition research into practical information for everyone. And in the research studies, people are getting dietetic support and review, they're getting medical support and review, and then bang, all the products are on the market and it's like DIY, and
Yeah,
then people can really run into trouble. So
yeah,
once you've
I
got
agree.
type 2 diabetes, you likely have other medical problems. You're likely on other medications like for blood pressure. And I know sometimes they need to be
They
revised
do.
as well, don't they?
They do. Yes.
Yeah, and so I always think it's a really good idea to start off with a health checkup. And let's face it, most adults are so busy they don't get around to even having that periodic health checkup with their GP. But that's a really good way to keep it. And then, Alan,
Yeah.
let's just talk too about the dietary fiber from the four. You said 2 to 4 cups of non-starchy veggies. Well, this is one area where the supermarkets, I think, have made that aspect a little bit easier, because you can buy bags of stir fry veggies. Like if you
Yeah.
go, okay, the only way I can do this is I don't even want to think about food. You've bought your box of formulated meal replacements, VLED. You can go to the supermarket, check on the pack, how many cups is that, and get enough for that first week. And then you're really seriously not going to have to think about it. And it's like you're doing your own experiment then on yourself. And then the other
Yeah.
thing that I like that you said is reminding everybody that the fat, that's just not for being mean, only use a little bit of oil. That's actually for protecting your health. So you get those essential fatty acids and keep the gallbladder pumping. And I think
Yep.
people don't realize that the gallbladder squirts out when you eat fat. So now you're eating hardly anything, and the gallbladder's just going, yeah, well, what am I supposed to do while you were trying your VLED? And you do not want to get gallstones. So
No.
I think it's important for people to know that if you want to see if you can respond, then it is following all the instructions. And you said, is that right? A lot of people go, oh, I'm going to skip the veggies, skip the oil, and just drink the
In
shakes.
my experience, they just have the shakes, and that's nearly, well, that's over 30 years of clinical experience, Claire. So,
Yeah,
which is a shame, and I have to remind them. Luckily now there's apps and other wonderful things to help remind people. I think I'm finding it easier in more recent years, but in
yeah.
days of the past, yeah, they could just get the shakes from the local pharmacy and just consume those and forget the rest. I think thinking that having less is better, but it is a package. It has been worked out over many decades, and it's for all-round health. It's not a race to lose as many kilograms as you can. We're aiming to lose body fat, and ideally from around the middle. And I think that's where, because of the language we use, we'd always talk about weight. We don't talk about fat loss. And I think, I'm trying to talk to my people that I see, when talking about fat loss, not weight loss, because the other side of the things that you mentioned is the real importance of physical activity or exercise. And that is an important component of this too, because that can help maintain that muscle mass. And that's really, really important. And again, there's much confusion I find out there. You hear and read that, oh, well, doing exercise doesn't help you to lose weight. And there's a grain of truth to that, because if you're putting on muscle, you're not losing weight, but you're probably losing fat, and in particular around the middle. And there was a really interesting study just published this week that showed that you could put type 2 diabetes into remission without weight loss. But if you read the paper, it showed because they were losing visceral adipose tissue or abdominal fat, and they're actually putting on muscle as a replacement. So, so we've got to stop thinking about kilograms. We've got to think about body composition changes, and the best tool for that's the tape measure.
Okay. Oh, you just preempt. You must have guessed what I was going to ask you about, because I was going to say, would it be helpful then for people, given that it is about like waist circumference loss, because that's the indicator of losing the fat, which is like clearing out the cupboard, so to speak, which means your pancreas is going to work better. So is it worthwhile people recording that? Because I think one of the frustrating things is, because your body's got water and, if you get constipated, you might mask actual numbers going down on the scale. So
Absolutely.
is the waist, people recording their waist circumference, do you find that your clients are actually happy to do that, to record that?
I certainly ask them, Claire,
Yeah.
but
Okay. Okay.
and every time I see them, I remind them. So I hope they are. But most of the apps are focused on weight, as you'd know. But certainly, I encourage that, and it's something they can do at home. I say use a mirror, get your spouse or partner to help you, so that and I say use the
Yeah.
belly button because it's there, it's easy. You don't have to measure.
Yeah.
You
Don't
and I
think
know.
where your waist is. Yeah. You can just
Yeah,
measure the
that's
belly
right.
button.
Just use that because the consistency is key, and do it on the same day, once a week, usually at the same time. That way you're minimizing all of those variables that you talked about, constipation, excess fluid, what have you. You can get rid of all of those confounding factors and get yourself a reasonably valid result that will give you confidence that what you're wanting to achieve, you are achieving. And I think that's really important.
Okay. So, Alan, can we just go back to the first few days of doing this? Because like this is a big change because I think often we eat too on autopilot.
We do.
So I
Yeah.
imagine having to even just get your kitchen all organized, have the special mixing up bowl, or if you're going to use a blender or you're going to use a whisk or whatever, thinking about all of those practical things so that you remember to start. Because
Yeah.
otherwise, you might just get up on autopilot and you've already had breakfast cereal, and then no, now you've got to wait till tomorrow. So, how
Yeah.
much does that part of it come into it when you're, counseling clients about getting ready to make a start?
Yeah, most definitely. I mean, the first thing is, of course, to discuss it with your family members or
Yeah,
living partners, to let them know, and even work colleagues if it's appropriate, what you're doing, because you don't want them to A, sabotage you, and B, you want them
yeah,
to support you. So
yeah,
there's that psychosocial side. And then, yes, you've got to, if you live alone, it's easy. You can either, well, you can wait and use up the foods that you don't think
yeah,
you need, if you're
yeah,
one that's against food waste, and I understand that perspective. But otherwise, lock them away or give them away,
yeah, yeah,
so that you've only got the foods that are suitable
yeah.
for you. So you've got to make that environment very conducive. And yes, I think the bagged vegetables are fantastic. And I do have quite a few people that have those regularly as part of this, because, the serve sizes, it's fresh and it's convenient. You can take it into work and nobody knows, so you're
True.
just having a salad. So, as I said, let people know if they need to, but if they don't, you're still
Yeah, you
eating.
don't want
And
to
I think
be.
that's the important
Yeah,
thing, So you've got to make that decision depending on where you work and how supportive your colleagues are. But
yeah,
that's part of it. It's not, food isn't medicine. You're not popping a pill
yeah.
off you go. It's got to fit in with your life and the people that you live with.
Okay. And now you mentioned a whole range of side effects. Is it helpful for people to keep a side effect diary? Like you said, they might get headaches. And is a headache because you get a bit dehydrated, or is that because you've run out of the stored fuel in your muscles and you're switching over to these ketones?
Yeah,
Yeah.
initially, and if it's in the first 3 days, I would assume it's you going into ketosis. But of course, that can partly also be dehydration, because as we know, muscle glycogen and liver glycogen, for every gram, there's 2 grams of water. So when you deplete those stores, you're actually becoming dehydrated. And that's just reminded me, thank you, that you need to drink at least 2 liters of fluids
Of
each
water.
day, on top of what you're eating and drinking in the very low energy diets, because it's really important to keep well hydrated and to flush out metabolites as you go along. But hopefully they subside. One thing that tends to linger can be constipation. Again, if you don't eat your non-starchy veggies and you're not drinking enough, and sometimes people get, bad breath and a few other minor symptoms, but they're really generally are quite minor. So if you've got through those first 3 days, which are the most challenging, then the research shows quite clearly, and there's been a whole range, as I said, over the decades, that people find it much easier than they expected. And I think that's really important. So there's, a lot
Yeah.
of fear initially, oh, I'm going to starve. This could be really hard. But once you get over that initial 3 days, it's actually not as difficult as you thought it would be. So,
So that makes sense in your what you said at the start about aiming to buy like a week's worth of products. Know that the first 3 days is going to be a bit challenging. Maybe plan some things to really distract yourself. And let's face it, all of us have got a list of jobs that we put off. So maybe putting a big list of those on the fridge, so every time you accidentally go to the fridge or the pantry, go, oh yeah, okay, go and do that one before I think about it. Expect there's some hunger, but it'll subside. Um, and you said you might get bad breath. I imagine cleaning your teeth is going to help with that
Yep,
as
sugar-free
well.
chewing
Extra.
gum.
Oh,
Yep,
great.
you know, there are plenty of things we can have for that. So
Yeah,
yeah.
yeah. And then, do people need to measure the ketones coming out in their urine? Do they need to do that? Or is just
No.
that smell of them on your breath enough to know, right, I must be producing ketones?
Yes, the
Yeah,
acetone, the nail polish smell is an indicator that you're in ketosis. And no, I don't recommend people get keto sticks. I know that was very popular back in the
yeah,
days when I worked for Diabetes Australia, New South Wales. There was a point in time where the local chemists were running out, and people with diabetes, of course, need them, particularly people with type 1, or at least back in the old days before there was ketone blood measurements. But for your average person, no, it's not necessary. Why waste your money? If you're doing it properly,
yeah.
then you should be fine.
Yeah, and I imagine then if you go, "Oh, I think I've got ketones on my breath. I think that my breath smells like nail polish." I reckon anyone in your household's probably going to tell you if you're not sure
Yeah, exactly. That's right.
if they can smell that. Okay,
Yep.
so people are underway. Likely their dietitian GP have suggested when they get reviewed. So let's say they're underway. They've made it now through the first 3 days. So is it time or the percent? Reduction in adipose tissue, which just means fat tissue. Can either of those come first, or is it pretty much 3 months for most people until you get that sort of
No.
kicking in?
Yeah, look, I've had people lose 10% within a month, if they are very diligent and adhere to the program, as optimally as they can. But it also depends on your starting body weight, of course. So if you're
Yes,
100 kilos, it's going to be 10 kilos that you need to lose as a minimum. And
yes,
depending on the person, so for a variety of reasons, men lose more weight on very low energy diets than women, but the range is 1 to 3 kilos a week on average. So obviously, the heavier you are, it takes you longer to lose that
yeah,
10% as a minimum. If you want to go to the 15% to increase your chances, then that's going to take you longer as well. So I think this is where it's personalised nutrition advice and staying in touch with your health professional. Ideally seeing whoever's managing or working with you on this, seeing them after the first week, and then maybe 2 weeks after that, and maybe a
yeah,
month after that. So you're pushing it out. You know what the trajectory is. And of course, the criteria for diagnosing remission is quite clear. It's a glycated hemoglobin less than 6.5%, and off blood glucose lowering medication for at least 3 months. So I guess that's where that confirmatory diagnosis, if you like, comes in. But if you've lost that amount of weight, then I think you can start the food reintroduction phase. And that's certainly what I would be doing. If you've lost the amount of weight, and if you've used a sophisticated tool like bioimpedance and you know that it's body fat, well, that's all the better. Or if your waist circumference has come down to your target, then that's also a good indication. So we need to be thinking. So
yeah,
it's not, you know, it's very personalized, and I think
yeah,
people don't appreciate. I think they have this misunderstanding that dietitians give out standardized diets to everybody. They use just the dietary guidelines for Australians, for example. That is not the case at all. It's about personalizing the advice to the individual based on how they're doing and their personal and familial circumstances, and that's really what we've got to do.
yeah. So Dr. Alan Barclay, accredited practicing dietitian. Do you also see people via telehealth as well?
Not at the moment, but I
Right.
but I have
Okay.
done. Certainly in the COVID days, I did.
Right.
But of course, it makes it hard because you can't weigh or measure people, and we know that self-reported data is not particularly reliable. So I do see people in person. That's my preferred option. But I have seen and will continue to have that
Right.
option, but it's not my preferred option.
Okay, and what I was going to say though is you jumped in and answered. I reckon you were reading my mind because you jumped in and answered some questions. So yeah, I wanted to know like when would someone know they've achieved reversal? And then you've already said that's because your HbA1c is well, when you have that test less than 6.5, I think you said,
Yeah, that's right. Yeah.
and you've gone for 3 months and you actually haven't needed any medications. So, in your experience, when people achieve that, is there also like a feeling of improvement in health and well-being, like for those people who, and recognizing that not everybody can actually achieve that reversal? Like, what do people tell you when they get to that point?
Most people are feeling a lot better, and I think, because we are, if we do it right, we're improving their overall nutritional status, which is a concept that I think is probably alien to a lot of people. But it means you got the right vitamins and minerals and
Yeah,
macronutrients, and generally you're feeling good. So yes, most people are feeling and looking good. I mean, I see people, on average, I probably see people once a month and not once a fortnight. So I can see the difference because I haven't seen them for a month. And you can see
yeah,
that they're looking better, they're moving better, and they
yeah.
are feeling better. But you do need an objective measure. Technically speaking, that's the definition of remission. So that's where
Right.
seeing your local general practitioner to get those tests organised to prove it, is a good thing. And I think,
Yeah.
there's a lot of lip service to the team care arrangements. We really need to put it into practice and work together.
Yeah, so hopefully, if people are eligible for one of those chronic disease management plans, they can again talk to their GP, which might require, will require a special appointment to set that up. Now,
Yeah.
Alan, I've got one more question. So now the person you're seeing has achieved reversal because their HbA1c is less than 6.5, been off medication for 3 months. Now, as you get older, your pancreas is getting older. Is reversal permanent?
No, it's not. So the studies, and I've quoted you the studies that are at the 12-month mark, and that's the optimum. It starts to drop off by 2 years. It's down to about 1 in 3 if you've lost 10%, and by 5 years, it's about 1 in 8 people that are still in remission, and that's from the UK's direct study, which is the longest and had the best
Right.
follow-up. But I suspect I might say that the direct down under, we achieve better results than the English, and I suspect there's a number of reasons for that. But one of them I'll say because the dietitians are better. But
I'll let you have that. Yep.
so we achieve better outcomes overall. So I mean, it'll be interesting to see. And I think part of the whole picture, and this is where it gets quite technical, is the whole food reintroduction process needs to be managed very carefully. And that's where you do need to work very carefully with your dietitian to slowly go back to a reduced or low energy diet, depending on the individual. And that's a decision that needs to be worked out with, the two people, the dietitian and the person that's wishing to go into remission, as to what's optimal. But basically, over 2 to 3 week periods, you go down from 3 a day to 2 a day, and another 2 to 3 week periods, you go down from 2 a day to 1 a day, and then you go down to none. And then you've got to decide what kind of eating pattern you wish to go back to. And ideally, that's going to work with the family. I mean, most of us don't live alone. We live in cultures. And although Australia is very lucky, we do have a great range of different cuisines and you can have all sorts of different eating patterns. We tend to eat what we grew up with, reflecting our cultural and ethnic backgrounds and what our family's food preferences were. So you've got to work out an eating plan that fits in with that, particularly if the person's living with other people. It's got to work with those other people. So it's a matter of working out with them a personalized eating plan that they can basically have for the rest of their days, because you don't want them to regain the abdominal fat. And that's really the key to this. And you raise an interesting thing. We're all getting older. Well, there is this thing called sarcopenia, another technical term, but that just means muscle wasting. And over the age of 45, perhaps uncoincidentally, when diabetes type 2 starts to go up, we start to get sarcopenia. And if we don't push back against that, if we don't do regular physical activity and decrease our inactivity, our muscles will waste away. And that just is a function of aging, I think, overall. So it's really important that you maintain that as well as healthy eating. So they're the key things. But of course, the last thing we can do nothing about at this point in time is aging. So
Yeah.
even if you follow a healthy diet and you're physically active, we're all getting older, and eventually, particularly if you're very strongly genetically predisposed,
Yeah.
it may come back anyway. But I think, without, dwelling too much on that, you will have kicked the can down the road. And we know very well from a lot of studies going back, getting on for 50 years now that if you get that glycated hemoglobin down and the other risk factors, you're going to delay the risk of getting the common diabetes complications, and there are
Yeah.
many, and they're quite horrible. So you've done that. So
Yeah.
you've increased your, and the diabetes prevention program shows that from the US, that your quality of life and your health, it does increase. So it's a worthwhile investment that will pay off in the long term, even if you eventually end up having type 2 diabetes again. You've had a holiday from it, and your body will be better off for it in the long term.
Yeah, really great comments. Yeah, and I think anybody who's done this and achieved it for a short period of time, like working with their body to achieve that, but over time, your pancreas, like your body, is getting older. But Alan, I just want to give you a theory on why the Australian studies had better results than UK. I actually think we have a better background food supply, and I know we have slight differences in our healthcare system, but I also think it's much more pleasant, particularly even in winter, to be outside in our country. So we're really lucky on some of those aspects of life that, if it's freezing and snowing and raining, you're not going to want to go outside. But also we have a more healthy foods in our supermarkets, really, compared to them.
Yeah, and they're more affordable. And that's what I know. Everybody's worried about the cost of living, but I've just got back from Western Europe, and things were in euros and pounds the same price as they are in dollars here.
Wow.
So,
Wow, that's not good.
which is quite eye-opening. So yes, our food is relatively affordable, I will say, rather than cheap, but it's affordable for most Australians. So.
Yeah. Well, Dr. Alan Barclay, thanks for taking us through diabetes reversal today. Is there any final things that you think people should know before they jump in and see if this is a strategy for them for reversing their type 2 diabetes?
You don't have to use very low energy diets, and there are other ways of achieving that weight loss. Some of them, like going vegan, for example, might be considered to be relatively extreme, but it is actually quite effective for a variety of reasons. But otherwise, just reducing the energy uh, intake from your diet, so around about 2,000 kilojoules, about 500 calories a day will help. Or you could even try intermittent fasting, which has become quite popular. And I do recommend for certain people I see from certain religious groups who may fast once a day anyway, well, why not do it twice a week? Build on what you're doing, and that way you're reducing your calorie or kilojoule intake as well. So I've focused on, we've talked a lot about very low energy diets. They're not the only way. They're what's been done in these trials, and they're very quick. But really, it's a bit like tortoise and the hare. The other methods will get you there. It'll take you longer. And sometimes for some people, and I see those people, it's frustrating that it's, maybe it's only half a kilo a week or less that they're losing. They want to lose more. But you don't have to. If you don't like the idea of having a very low energy diet, there are other ways. And I think you should discuss them with your dietitian. Don't just say, well, it's that or nothing. It's not. There are plenty of other options.
Yeah, that's a brilliant spot to leave it. So we're reminding everyone to talk to their GP and ask for a referral to an accredited practicing dietitian to improve their diabetes related health. So, Dr. Alan Barclay, thanks for being our guest on Nutrition Science Bites today.
Thank you very much, Professor Claire. Really appreciate it.